Bernstein Show. Here's Ed.
As my wife, Claudia, beautifully put it, Brighter Days, a book she wrote, Brighter Days, 88 Lessons Learned in Life for Women Who Want to Increase Their Confidence, Resilience, and Courage, is a love letter to your future self. And let me tell you, it's already changed so many lives. The book is not just insightful, it's funny, it's relatable, and it's exactly what you need to spark transformation in your life. Tomorrow, July 14th, it will be available on Kindle for a limited time offer of just 99 cents. That's for you, viewers. That's right, 99 cents, a book that can change the way you see yourself and the world around you. Go ahead and click the link on the screen or head over to Claudia Noriega Bernstein's website. If you can't remember the whole name, it would be Claudia Bernstein. Google that. To pre-order your copy now. Trust me, this is a deal you don't want to miss. Get ready for a journey of growth, resilience, and embracing your true self. And once you work on the inside of who you are, women, particularly women, this book is really especially geared toward women. And once you work on fixing the inside, then what's left is working on the outside of your body. And that includes a lot of the energy that does permeate on the inside. My guest, Dr. Pej Bady. How are you, sir?
Good, thank you.
Good. And I don't know if you know Claudia was an author, right? So she works.
I met her before. I just didn't know she's an author.
Yeah. She's a podcast, an author, and she works on working with women, coaching women.
Oh, that's amazing.
You're a man who I've seen many times, who I consider you my, I wouldn't say coach, but my, curative physician for a lot of things in my life. I met you a number of years ago when my knees were bothering me, and I heard about PRP, not really quite sure what it was at the time. It's probably a decade ago. And we worked together with some PRP. Then ultimately, quite honestly, my daughter had a problem with her Achilles tendon.
Yes,
my daughter was a cheerleader and was a flyer, and years of cheerleading really messed up her Achilles tendon. You know, she wore boots. You know, the boot you wear when you got a bad leg, for years.
Yes.
We could not get any relief. She got injections, steroids, that type of thing. Nothing worked. Came over to your clinic, and she got a stem cell. And I got to tell you, she's been bouncing around ever since without a problem.
Well, that was years ago.
And I am a believer. I am a believer in this stuff. And I want to talk to you because there's some great new innovations with stem cell, particularly stem cell research and some of the work that you're doing.
Yeah, sure.
Right? What exactly stem cell? Why don't we start there?
Stem cells are, as what we call stem, which is like a stem of a plant or a tree or whatever, where everything begins as an embryonic state, as a state that these cells are able to regenerate and also become any cell, right? So, which is called, we call them the mesenchymal stem cells, right? And mesenchymal stem cells are what we call pluripotent. That means that they will become anything. So if we get this mesenchymal stem cells and we inject them in your heart, they will produce cardiac muscle. If we inject them in your kidney, they will become kidney. Or if in your joints, like you, they become cartilage. And they're actually pretty cool looking under electron microscopy. They look like octopus. Uh-huh. They have a big body, some tentacles, and when we inject them, it takes about 6 weeks for these tentacles to attach. Look, for your particular case, your knee. I'm okay to talk about your knee?
Yeah, sure.
The tentacles attach, and it takes them 6 weeks. And once they attach underneath their body, they produce a bunch of stuff, mRNA and growth hormones, many different kinds of growth hormones, and they start producing the same exact material that they're sitting on. So in your particular case, in about 3 to 12 months, that all the degenerative cartilage from arthritis, people always come to me and say, I'm on bone on bone. No, you're not. 95% of the people that come in and say, I'm bone on bone, they're not. And these transplants, we put them on, and within 3 to 12 months, they produce an entire new set of cartilage on your knees. You get a new knee.
And does it last?
Oh yeah. We've been doing this 8.5 to 9 years.
So when I met a man this morning, sitting next to me in a waiting room over at the eye doctor's, had 2 new knee replacements, and he said the exact same thing. Hey, I was bone on bone, had to get 2 separate knee replacements. Right? I mean, that people come in and talk about that all the time. How does one know if a stem cell procedure would work instead of a knee replacement?
That's a great question. I would say 75% of our business are knees, because we stand on them all day long and we get them all the time. The real way is you have someone who's experienced to examine the knee. We'll get MRIs. The MRIs will show a lot, and X-rays and so forth. But I'm old school. I've been practicing for 33 years, and an experienced physician that will be able to evaluate the knee will tell you. But in general, if you don't have complete flexion or complete extension because of arthritis, you need a total knee replacement. If you have severe angulation, so if it's a physical deformity, you need a surgical intervention. Anything less than that, we've done.
There's aches and pains, and you wake up in the morning and you're trying to get out of bed, and I got to move that knee. That's something you think you can improve.
Yeah, we do really well. We started using an umbilical cord and placenta tissue 8.5, 9 years ago, and throughout the year, and then we just used to inject them. I can get my needle in a knee literally with my eyes closed. But now how we do them is everything's done in our operating room. Everything's done under live CT, and we transplant them as opposed to inject them, meaning that whichever knee that we get or joint, a portion of it is doing worse than the other portion of it.
Right.
So we specifically transplant the areas that have more damage. Now we put them everywhere, but these...
And you're viewing it as you're injecting it, so you see where the damage is.
Live CT in an operating room. So and now we've kind of migrated from doing it blind or under ultrasound to live CT, and also moving from material from the outside world, meaning the allogenic umbilical cord, placenta, amniotic fluid, into autologous coming from the patient. And our outcomes have increased from 45 to 55% to 86 and 82% respectively for fat, adipose tissue, and bone marrow from the patient.
So that's even more effective than getting it from a third
100%
person or
100%
embryos or something.
Yeah. So and the reason is pretty simple. The biggest question and the misnomer, and we believed it for a while ourselves. Mm-hmm. We've been doing this for a long. We're one of the pioneers of it. So we really had we've had thousands of patients for trial and error. And we believe that whenever you buy something from the outside, you get it from the umbilical cord, whatever it is, it comes in frozen. By the time we get it and we thaw it out, then some die, a good number of them. But the real question is, if you're a healthy human being, you have an immune system. Just like when you get a cold or you get a cut, your body sends all this protective killer cells to destroy whatever is coming from the outside. Anything that we put in there the majority of them will be destroyed. However, when you get tissue from your own body and inject it, there is no destruction. Your body recognizes, and we don't freeze it, we don't thaw it. Everything is done within 2 hours. Patient comes in. I mean, you've been there, right?
Right.
In and out. And the key is the limited time so it doesn't stay out. Our record is 22 minutes to get this stuff from you back in your body, right? So we don't freeze, we don't thaw, natural, and it responds. And we get those mesenchymal stem cells I told you about, and we inject it. We have all of it. We could do all of it. If the patient has cancer or under chemotherapy or as a reason that we do not want to use their own tissue, then our second backup would be other tissue, including umbilical cord or placenta, amniotic fluid. But now, in the past 6 months, I was speaking at the Global Stem Cell Conference, and one of the things that was brought out is exosomes from your own body, that we just take the blood, we send it in, and within 2 weeks they'll send back to us the growth hormones and the mRNA in the form of an exosomes that we could inject in the joint or in the vein.
And what is an exosome?
Exosome, exo means outside, zone.
Right.
So non-living, non-tissue material extracted from your own tissue, which is the mRNA and the growth hormones and all the other stuff that we talked about earlier. And we take that and then we use the exosomes, which is extracellular. It's not a cell. It's something, it's acellular. It's not alive anymore. And then we can inject that in your body.
This is all so new. It's it's a new frontier, and it's like many things in medicine that are new. It's very confusing to people, to patients. How do you know, A, where to go, and B, how do you know when to go to a physician?
There's pre-disease process and a post-disease process. Post-disease is you got something wrong. If you're a baseball player, you got a rotator cuff tear, you don't want to have surgery, stem cells. If you have
as you're talking about this, in that kind of situation, do stem cells for I guess a partial tear, or is a total tear you have to have surgery?
That's 100% correct.
Right, but you have a partial rotator cuff tear, you get stem cells. So how effective is that?
Depends on the disease process, but most joints are extremely efficacious. But we have to identify the patient right? If it's a labral tear it's not even a full tear, but it goes along the side in a way that the range of motion is not there, or is really bad. It needs to be cleaned up first, surgically, then stem cells to heal it faster. But everything we have to examine. Us as a group, we need MRIs, we need X-ray. We really look at what we need and identify if the patient needs to have surgery or not. We have an orthopedic, board-certified, fellowship-trained orthopedic spine surgeon in our group. We have a board-certified, fellowship-trained physical medicine sports rehab doc. We have our main guy is a Harvard guy that does all the spine injections for us, the spine specialist. So so identifying the right patient is the key.
So that's an easier situation. You have an acute injury, an athlete hurts his rotator cuff, and then you can respond that way. And we're talking about when to go. Okay, right. So that's an obvious thing. Oh God, my shoulder! I need to get it fixed. Right.
So two phases. One is when you have a disease process. The disease process could be acute or chronic.
Right.
Chronic arthritis in the knee. I'm 58 years old. My left knee is hurting. If you allow me to go on a quick tangent, real quick, I have dedicated my life to this as of 3 years ago because I'm a patient. I had a 3-level spine stenosis with a foot drop that I couldn't function. I had so much pain. My brother's an orthopedic surgeon, spine surgeon. He said, you have to have immediate surgery, 2 weeks out. I'm like, there's no way I'm going to let you guys open me up, take my organs out. So we did the biggest stem cell procedure on me 3 years ago. I'm back at tennis, rotational sports, changed my life, and I'm dedicating my life to this because I believe it's the future of medicine. So if you're doing it for a disease process chronically, it's a great choice. Acute, we could go between PRP and stem cells. But some people use it prophylactically. For example, the exosomes intravenously. It allows you to have more cognition, you age slower, and you mix those up with NADs, some of the other stuff that we do for energy levels, and it's just a whole different level of processes.
I used to hear, I have friends that do similar types of things, but they had to go out of the country to do it in the past. That's not true anymore?
Yeah, so let me lump that up in the question of where to go.
Okay.
All right. So there's a few companies in the United States that are under an FDA-controlled IRB study, which is an investigational study, that are allowed to do a lot of these things. We're one of them, but there's many, not many, there's probably 22, around 22, 25, something like that. And they could do most of this stuff, including umbilical cord and so forth. Our group uses, we're in Nevada, Vegas, and we take some of our patients to the Indian reservation to do the injections, just to be very clear, not to break any laws. But there's a lot of places that we don't have to leave the country to get this stuff, right? The places I would stay away from is that if they're not doing the procedure in an operating room, because no matter what, this is live tissue that we're getting from yourself and putting it back in. It has to have a clean room with a laminar flow, air evacuation systems, and so forth. Secondly, if they're not transplanting this with a live CT or X-ray in an operating room,
then they're guessing.
It's not. That's the thing. Yeah, it's not right. It's not happening.
Right.
It's not happening. If the physicians that are doing it, there's a lot of places that are, nothing against any providers, but they're physician assistants or nurse practitioners, and they hire doctors to be the medical director, and just like,
right.
You need board certified specialists in that particular field to be doing the injections. You can't have a physical medicine physician injecting your spine.
Right.
We need a spine specialist to do that. So those are the things that you want to make sure that you stay away from if they don't have an operating room and so forth. And some of the reputable places are able to do everything that is being done outside the country now.
And of course, I assume that the majority of this is not covered by insurance.
No, it is. Right. All of our patients go to physical therapy. I'm a big fan of physical therapy. That's covered. Right. All of your diagnostic studies, X-rays, MRIs, and all that are covered. But the actual procedure of stem cells, because it's still investigational, the CMS, Medicare, or any other insurance won't pay for it.
Give me an idea, like a range. Like, let's say you do have a partial rotator cuff tear, and you want to do stem cells, and to go through the process of injecting the stem cells, is it tens of thousands of dollars, or hundreds of dollars, or thousands? What is it?
Our PRP injections, again, depending on what the process is, if it's a ligamental thing, we'll just use PRPs. Either a single PRP or a series of 3. A single PRP starts at about $900, $850, $900. And our very, very complex spine cases with multiple levels and so forth, that's about $15,000. The majority of our stuff that we do on the stem cell side is around $8,000. And
what's just a simplified difference between PRP and stem cell?
PRP is, I can make it super simple. We take the blood out, we spin it really fast, and we get the platelet-rich plasma, PRP. Okay, so it's a plasma. We separate the plasma, and then we inject it back. Sometimes we add certain things to the PRP depending on what the situation is, but that's basically what it is. It's coming from the blood.
Right, and I should say I've done this multiple times in my knee, and it has helped. It doesn't last forever. I have to go over once or twice a year to do it. But it's the amount of time. It's quick, and it's not all. It's a little bit of pressure in your knee, but that's it. And oftentimes the same day. I'm not going to. Don't tell him this, but I can also exercise the same day. With the stem cell, because I have experience with that with my daughter as well. You actually took some fat from her. Liposuction, right? So you can really, sometimes you can kill two birds with one stone with this.
We are not cosmetic doctors, right? And so we don't take that much fat cosmetically. But something that's really cool that's come up, and I talked about it, we do cryopreservation. So we actually take more fat, and we do the procedure 2 hours in and out for your joint, whatever you want to do, spine. And then we can send this extra amount of fat and cryopreserve it with another company. We don't deal with it. Freeze it. And then you get your own fat once. You use it for whatever you need at the time. And then you could use that fat and the company grows it so you don't have to get any more for the rest of your life. And used for cosmetic reasons, hair, spine, joints, IV, all of it. And that's another thing that just came up at the last global conference I was at. That's really cool. I like that. And now we also can do IVs. There's a vascular portion of the fat that we could get it small enough that we could inject it in your vein for longevity, right? And the exosomes that are running about $4,500, the one I told you about, from your blood, is amazing. I've done it to myself. We wouldn't do anything to anybody unless we do it on ourselves because it's investigational. But I've given it IV to myself 2 months in a row, and it is just unbelievable. A lot of the aches and pains that I had went away, and actually my vision got better. I wear glasses regularly, and but my cognitive ability, and this is what I've heard with a lot of these patients. So there's all these new cool stuff that's coming up. We're in the front here. I love it. It is life-changing. I've been practicing medicine for 33 years. My dad's my brothers. We're all doctors. I've never seen anything like this. And I always say, I give a lot of speeches, and I always say anesthesia 100 years ago was a piece of stick in your mouth and a bottle of whiskey.
Right.
Now you go have your hip replaced, and you wake up and you say, "Is it done?" This is what happening with stem cells. It's really changing the trajectory of humans. And I'm also part of this group called Abundance 360 with Peter Diamandis. He used to say, is an amazing doctor, actually. He's an MD, works with NASA stuff, artificial intelligence. And he's telling us, 2 years ago, it's like, well, we get to live to be 120. This year, is like, well, how long do you want to live? With the AI coming on, the stem cell regenerative medicine, understanding and the blood testing, the laboratory testing that we're doing, that we identify like you're declining your cognitive ability. And what does that mean, age-wise? And we can actually measure your age. I'm 58, and I'm measuring about 50 now. My goal is to live to over 120 years. That's my goal.
And to be healthy during those 120 years. That's the important thing, right? Is staying healthy from all of this.
And exercise. And Ed, I used to see you in hot yoga classes. It's amazing. Heat generated, increasing your core temperature, decreasing your core, like ice baths, exercising. All this stuff is with longevity, mixed with NADs and stem cells and AI to be able to, right now, one of the things that are being done is you can actually look at if you have high cholesterol, you're on statins. It means at this point, the studies are coming out, is really that is not an indicator. The indicator is, are you having plaquing in the arteries of your heart and your brain or not? And now we do a CT angiogram with an AI follow-through that allows to look at the soft plaque that gives you the incidence of you having a heart attack. It's insane what's happening. It's just so cool. The future is so bright. And the last book, one of the books that Peter Diamandis just wrote is like, don't die from something stupid, because you're going to live for a long, long time.
So if people want to explore this more, name of your facility.
Cellaxys.
Cellaxys. And so you can reach him over at Cellaxys. Dr. Bady, be happy to talk to you about any of these kind of procedures. He's doing them himself. I mean, what more proof could you want, right?
Yeah, I'm a big believer of it. Yeah, thank you.
And how long does the whole process take? Like if I call in, I have I got a knee problem or a rotator cuff problem, and to call in to get an appointment to go through the stem cell extraction and to get the injection, the infusion, and it can all be done within a month, right?
2 visits.
Yeah.
If you have all of your studies. Most of the patients that we see have their own MRIs and so forth. They've already been to an orthopedic surgeon or whatever.
Made those rounds, not satisfied, and they're coming to see you.
Yeah. So they come in with their studies. We take a look at this. We do the exam, figure out what they need, and then we'll schedule them. It depends on how busy we are. We schedule within a 2-week period.
Right.
The procedure itself is no more than 2 hours. We do have an anesthesia team. By the way, that's another thing that you need to look at.
Right.
If they do not have an anesthesia team, they're not doing it right. Right. So we knock you out. You come in, do the fat or bone marrow extraction, or if we only use exosomes or whatever it is. And the procedure is like 2 hours. The procedure itself is like 20, 25, 30 minutes.
But you have to recover, and there's that type of thing.
So 2 hours, you come in, you're out within 2 hours.
Thank you so much, Dr. Bady. It's great to see you. You're doing great things for a lot of people. And don't forget, you can go into my wife's link here, and 88 brighter days, 88 of the most important lessons learned, particularly for women. 99 cents, you can't beat it. Thank you, Dr. Bady.